Good morning, everyone, and welcome to the first lecture of the first module in this course, The Principles of Medical Ethics and Communication Skills and Medical Law. During this lecture, I will introduce to the subject of communication and show you how it is important to effectively communicate with the patients and next of kins. I will try to show you how to plan for and run effective communication station and meetings. I will try to let you know the components of the British health system for those who are going to work in UK or are going to sit for the BASIS exam, and also the most common items in the communication station, the ethical and legal issues that you should keep in mind throughout not only the exam stations but also your whole life. I must here disclose about the conflict of interest. The author do not have any conflicts of interest to declare, whether financial or non-financial. Nothing was personal, religious, or political relevant to this topic at hand. In the introduction, we must know that the healthy doctor-patient relationship is the cornerstone of success in any medical procedure. Much patient dissatisfaction and many complaints are due to the breakdown in the doctor-patient relationship. The advantages of good communications are: first, the patient is more satisfied with the provided care, better understand of his or her problem, investigations, and the treatment options, so that he will not be disappointed if his condition did not improve. The patients are more likely to adhere to treatment and to follow advice on behavior changes. The stress and their vulnerability to anxiety and depression are lessened. Doctor own well-being is improved, and doctors are less likely to be sued. The five key communication skills that must be present in all treating physicians are: first, they have to listen effectively and take patient concerns seriously. Second, second thing that they have to elicit information using effective explanatory skills. They have to counsel and educate patients effectively, and they have to make informed decisions based on patient information and preference, and know how to break bad news. We all enter the exam room with our agenda, and we usually want to finish this agenda in the recommended or suggested time. But remember that communication with the patient, with patients and communication station is a two-way dialogue. It's not a one-way dialogue. So sometimes the patient will interrupt you, he will stop you and start asking questions. So don't panic, be flexible and start to answer him, or at least tell him that I will answer your question. Try to provide information the patient wants and not what you want to tell him, and apologize when mistakes occur. Adopt mindful practice and be able to deal with emotions. The types of communicate questions used in communication are open-ended questions. They are good questions and not closed ones. And usually we start with open-ended questions. First, to know what the patient exactly know, and at the same time to correct his knowledge if something is wrong, and also to save time. And the importance of these open-ended questions at the start of our dialogue is that they will give you few seconds to recollect again after coming up from outside the room and after sitting and shaking hands with examiners and the surrogates. So they will give you some time to plan for the what's coming and what's going on, and the next step in your discussion with the surrogate and with your and in your dialogue. Explanatory, they are good and not leading. Single, they are good and not complex or multiple. But by the end of the discussion, you have to use close-ended questions like do you smoke, do you drink alcohol, do you live alone, and so on. What do you do for living, and so on. The communications are either verbal, like talking and using words, or non-verbal. They are very important, and this includes the facial expression, like smile, using lips and head nodding. But remember always to keep an eye contact but not gaze, to adopt a special posture, which is you have to bend slightly to impress the other side. Don't sit with a straight back, so that you will give him impression that you are just talking him talking to him from a higher point, or you are slightly grandiose, and so on. Keep a good distance, and if you enter the room and find the two chairs are close to each other, no problem, don't panic, and take the chair slightly outside and keep it in an average distance between you and the surrogate. Regarding the touch, never touch the surrogate or the patient in bases to show sympathy, but in some communities they do but in some communities it is not allowed at all, and also it's not allowed in different gender, and it's not allowed in different age groups. In the 5 minutes outside the room, write down your name and role. Write down the patient next of kin name and role. Remember to write the job, and remember to ask if he or she likes to involve or invite others in the meeting, and we will discuss this later on. And remember to confirm the agenda. The agenda may be stated in the case scenario or anything else raised by the patient concerned, or any hidden agenda, and we will discuss this also later on. Also remember the collaterals of the history, like you have to ask him to sign a consent or tracing of contacts by informing the local health authorities, informing of GP or occupational health workers or therapists or local health authorities, as I mentioned, driving the oral contraceptive pills, and considering pregnancy if the patient has a disease that interfering with the normal pregnancy. And remember the class strategy, and remember always the concern of the patient. The agenda is, as I told you, is any issue that is given in the scenario or mentioned in the GP letter, plus any concern in the patient mind. It might be in something that he forgot to inform his GP about, and also the agenda is anything that you can work out from the scenario. For example, if you are asked to discuss the condition of a terminally ill patient or futile patient with his daughter, and then it is very essential to discuss a DNR. And also, when you are explaining the diagnosis of epilepsy in young lady, you have to consider the driving, the fertility, you have to consider also and special habits, special hobbies, and so on, and the exercise that she is practicing. Also, it's very essential issue to include in this discussion. You have to find also the ethical and legal aspects of this scenario, because this is the first point you will be asked about when you finish the discussion and finish your dialogue with the surrogate. First thing the examiner will ask you about is what are the ethical and legal aspects in this scenario. So you have to keep them always in mind, and you have to prepare yourself before starting the discussion with the examiners. So remember, from 1 to 6 is considered as a starting strategy. Remember to write down the main items in the core of the discussion, and we will discuss this later on. Explain the main items. In the breaking bad news, there might be procedure, counseling, and consenting, and this is also the hidden agenda or the collaterals of the history. And always remember the pregnancy and the driving. Once you enter inside the room, start by introducing yourself. Your name might be stated in the scenario, so use the name stated in the scenario, and also use the role stated in the scenario. If it's not stated, just mention that I am Dr. Sharif, for example. Your name, mention your name. I'm one of the doctors here today. Try to create a rapport so that first, when you enter inside the room, you have to shake hand with the examiners, you have to shake hand with the surrogate, and you have to say good morning. He will reply good morning. I am Dr. Sharif, one of the doctors here today. He will say, how are you, doctor? I'm okay, thank you. How are you today? I'm okay. Then you have to start by asking him or her about her job. Then you have to ask him if he or she would like to invite one of his family members or friends to attend the meeting. And then you have to agree for the agenda. Agree for agenda, for example, like I think we are here today to discuss the condition of Mr. X, or I think we are here today to discuss the results of the investigations or blood works and so on. The conditions where you have to ask the patient or the next of kin or the surrogate, do you like anyone else to attend our meeting, are of sure serious problems that needs sharing and also support, like breaking bad news, taking the decision of DNR, post-mortem examination, hereditary diseases, and counseling, and HIV and AIDS disease. These questions or not? So the main stem of the dialogue will be containing the most common or most important skill in this station, which is the communication. We have to adopt clear and accurate, structured, comprehensive, fluent, professional technique, explore and explain to the patient or surrogate, and at the same time, you have to have this skill all over or all through your uh, discussion with the patient. After that, you have to explore the ideas of the patient and ask him about his concern and ask him about his expectation. This is called the starting ICE or ICE protocol. So, why we are asking about the ideas and why we are asking about expectations, we will discuss this later on. But the important skill here is the concern, because you must be asked here and also later on in the closing, because the concern, as we will know, is a dynamic process that may change, or he might be having a new concern. The third skill that will be present in the main stem of the communication station is the judgment. Judgment means that you have to tell the patient, and later on also this can come in the discussion with examiner, what will be the management, what are the ethical and legal issues that you need to inform the patient about. And the last skill is the patient welfare and maintaining the respect, dignity, safety, and comfort of the patient or surrogate is very important. And this also should accompany you throughout the whole station. And not only the whole station, actually, the whole life. So the social history is only permitted history here and very much required. Usually in the stem of the scenario or the stem of the exam scenario, you will be informed that you should not take a history. This is not a history station. Yes, this is not a history station, but the social history is by far very important in this station. You have to ask about it in details, because it will make a big difference in your discussion. It will make a big difference about your plan of management. So we will discuss the IEC in more details now. The starting of the main stem of the communication station. It's very useful way to explore the problems and patient concern. So the ideas are the patient about the condition. You have to ask him, what do you know about your condition? And this should be the starting question in every communication session. So what will be, what do you know about your condition? And do you know what brought you here? And so on. So this is very important to ask about. He will start telling you, he will start to talk for few seconds, and you can collect yourself at this time, and you can prepare for the next questions. You have to, this will help you to save time. If the patient has the right idea, then you don't need to repeat things again. It will help you also to fill any gaps in the patient knowledge, and to correct the patient if he has wrong information or misconception. So you don't have to do this by the end of the discussion. The expectation is in what way you expect us to help you, and what do you expect about your illness to be, or what do you expect the results of the investigations to be. The concern, you must ask about the concern after the I and E, and some doctors prefer to put the C in between the I and E. So for me, I prefer to ask the concern about the I and E. Because the concern is a dynamic process and he may develop other concerns, as I said before, after the meeting with the GP, and breaking bad news will usually lead to a new concern, so ask him again at the end of the meeting. Some doctors prefer to adopt the class protocol. The class protocol stands for, the C stands for the context. He preparing a quiet room and put him at ease. And remember, this should accompany you throughout your practice. Preparing a quiet room always. Don't tell the patient the diagnosis, or don't tell him or break a bad news in the hospital corridors. Don't treat your colleagues in the corridors. If one of your colleagues told you that I have a health problem, just take him and sit with him in a quiet room and listen to him effectively as if he is one of your patients. Don't just like tell him that this is very simple, take so and so and so, and do the same thing also for the patients. So the C stands for the quiet room and put him at ease. L stands for listening. GMC states that the doctor must listen to the patient, take account on their views, and respond honestly to their questions. A, acknowledging the patient emotions, and this is by far very important. You have to show empathy and sympathy. So what's empathy? Empathy is sharing, caring, and understanding, and sympathy is feeling sorry when the patient or the situation is difficult for the patient or traumatic to another person. So in empathy, you have to use phrases like "I really feel same as you do" and "I share your feelings." Also, "we will do our best to support you." This is an empathy. Sympathy means that you have to tell him that you are sorry for this situation or for the difficult time, or you are sorry for telling him the diagnosis. The S&S stands for the strategy, plan, and contact numbers and others, and the other S stands for the summary and check understanding. And this is the closing of every discussion. And some doctors prefer to take a combination of both. The summary and check understanding should be in all discussions. And as I told you, doctors prefer to take the combination of ICE protocol and class protocol. In every communication, to the patient, you have to show sympathy and empathy, and always remember to ask the patient about his concern, explore it, respond, and manage it clearly, and ensure the patient satisfaction. I'm sorry to repeat this again and again, but this is by far extremely important. You will never get the full mark without showing sympathy and empathy and asking the patient to what extent this problem affect your daily life, your daily activity, or daily life. So this raise the importance of taking the social history in the main communication issues that you have always to keep in mind and memorize, because you are going to be asked for, and you have to also search for in your scenario. First, the ethical issues like respect for patient autonomy, beneficence, non-maleficence, justice, consent and counseling, confidentiality, disclosure, and public interest, and we will discuss this in the coming lecture. The public protection issues, first, like driving in epileptic patients, in diabetes mellitus, and also in patients with TIA and syncope, and patients with heart disease, in genitourinary infections and communicable diseases like HIV, TB, hepatitis B, C, and meningitis, and also breaking bad news issues. Also, the medical legal issues, resuscitation and DNR, advanced directives, brain death and persistent vegetative state, coronary referral, euthanasia, post-mortem examination, organ donation, and religious counseling and consenting that you may have in your scenario might be multiple sclerosis case, ischemic heart disease and cardiac rehabilitation, cystic fibrosis, Huntington disease, rheumatoid arthritis, uncontrolled diabetes, and bronchial asthma and COPD. Procedures that you may be asked to counsel the patient for are heart-lung transplantation, coronary artery bypass grafting, bronchoscopy, endoscopy, and renal biopsy. The British health system, for those who are going to sit for the PACES exam or those who are going to work in UK, the guidelines and policies are produced by the JMC, the National Institute of Clinical Excellence, NICE, and the Scottish Intercollegiate Guidelines Network, SIGN, and the Royal College of Physicians. The hospitals are under the management of the National Health System. There are also GPs, so there are also the social services system, the home health care, and the preventive section with the CDC. There are legal advisors and coroner system in the hospitals. There are also specialized nurses, district nurses in all districts of UK, teams like Macmillan team, they are voluntary teams, nursing homes, voluntary agencies, supporting groups, and societies. By the end of our talk today, you must now know that healthy doctor-patient relationship is the cornerstone of success in any medical procedure, and this can only be achieved by effective communication. And now you know exactly that there are 5 key communication skills, and know the strategy outside and inside the room, the ICE and class protocols, the main communication issues, and the British health system. Thank you for listening and wish to see you in the next presentation.